Raymond, his parents describe him to us as just a really happy and active child. He loved skateboarding, he loved playing the keyboard, but following his 8th grade year, that's when COVID hit. So he became really depressed and was really struggling with depression and then increasingly thoughts of suicide. The ER recommended that he be admitted to Vista Del Mar Psychiatric Hospital, which is supposed to be providing intensive and short-term treatment to help stabilize patients like Raymond.
Around the time that Raymond was admitted to the hospital, there was sort of this string of really serious incidents that happened there. 5 patients who died, either in the hospital because they weren't properly monitored or did not receive appropriate medical care, or shortly after being unsafely discharged. Caretakers within the hospital were telling health inspectors that patients weren't receiving basic care like therapy. And so this was the sort of environment in which Raymond arrived at the hospital.
He was able to attempt suicide not long after being admitted to the hospital, and as a result, he was put on one-on-one monitoring. Raymond was taken off that one-on-one supervision, even though he had told caregivers, and it was documented in his record, that he would try to kill himself once he was taken off one-on-one. Over the course of the last year, we've been investigating for-profit psychiatric hospitals in California and the dangerous conditions in their hospitals.
Signature is the largest operator of these freestanding psychiatric hospitals. They run 9 facilities from San Diego to Santa Rosa, and they treat tens of thousands of patients each year. We actually analyzed hundreds of these reports, what are called deficiency reports, that the California Department of Health issues when they find that the hospitals have violated some sort of state law or regulation.
About 2/3 of the patient deaths that were linked to deficient care at for-profit psychiatric hospitals were connected to Signature facilities. There seemed to be a really troubling pattern there with Signature hospitals, which led us to start investigating their business structure and how they operate.
Signature Healthcare Services was founded by a man named Dr. Soon Kim. He began his career in Michigan, first as a psychiatrist, and then he sort of worked his way up to be the CEO of this hospital management company.
We looked at how Signature operates. It has used a related party payment structure where each individual hospital, they pay other companies that are connected to Kim money for management services, for IT support. They also pay rent. In 2017, Dr. Kim sold the real estate at 6 of his hospitals for about $400 million. And as part of this deal, Signature agreed to lease the hospitals back from their new owner and continue to operate them.
The rent prices after this deal doubled, about 20% of their operating expenses on rent alone. And that's really out of line with other similar hospitals in the state.
While sale leasebacks are legal, the effects that they've had on hospital systems around the country are leading some states to really scrutinize and really limit their use in healthcare. We spent quite a long time talking to Elsie and Lionel, Raymond's parents, and they were obviously shocked and devastated by what happened. Families that we talked to, their ongoing grief, the loss that they've had to deal with, and their willingness to share that with us made this reporting possible.
We're going to continue to report, so if anyone has any tips, if they want to reach out, we would be happy to talk to them.